Welcome to Dental All-Stars. I'm Alex Nottingham, founder and CEO of All-Star Dental Academy. And with me is Dr. Paul Etchison. And the interview that we're doing is part of a collection of interviews focusing on business and personal growth. And the topic that Paul is going to talk about, Dr. Paul, is motivation and inspiration how to massively impact your practice. This is what he's talking about, the Practice Growth Summit. And when it comes to practice growth, we have an entire event that I just alluded to that's dedicated to personal and business growth for you and your team. And that's called the All-Star Practice Growth Summit, this upcoming May 17th and 18th in South Florida. And you can learn more about the event at allstardentalevents.com. Please welcome Dr. Paul.
Hey, thanks for having me again, man. And yeah, looking forward to the summit. It's a great lineup. I was looking at the lineup, I mean, you asked me to speak and I said, yes. I didn't see who was going to be there yet. And I know many of the speakers and I'm really excited to come and hang out with everybody. And I just think it's going to be a cool business summit. It's going to be a really good one.
Yeah, it's a great group of people. And that's the idea, is bringing the best on personal business development together. I mean, versus having to go all around and find them, I bring them all into one place. I also forgot to mention as well that you are a popular podcast host of Dental Practice Heroes. And you also wrote a best-selling dental book as well, Practice Heroes. And you mentioned All-Star. That was cool before we even got to know each other. So that's nice. It wasn't, I didn't grease the skids yet, with respect to that. So I appreciate the unbiased approach there.
It was.
Yeah. So I'm going to get right into it, Paul. So before we have a series of questions I have for you, not as fun as the questions that you have and all those sound effects on your podcast, which are kind of cool after the fact. And I did well with your questions. So, Paul, how would you define, we're talking about growth. How would you define growth and why is it important?
I would say, I mean, we can all grow. There's always growth. And when we look at growth, we're always looking at numbers, collections, all this. But I think as leaders of a practice that wants to inspire a team, and this has always been a big part of what I preach and what I teach, and is that we need to get the team involved. The team has to be involved in everything. And they're not going to want to grow the practice for the sake of production and collections. They want to grow it because they want to do the absolute best they can for the patients, and they want to do the absolute best for their team members, their other teammates. So when I say what is growth, there's always going to be areas of your practice, personally as well, not just professionally, but there's always areas that we can improve on. You're never going to find perfect. So growth is just looking at areas and not necessarily saying, hey, we're doing bad here, but saying, can we do better? And that's what I want to do when I talk to my coaching clients or practice owners. Can you do better? There is always somewhere you can do better. And I'll give an example with my front desk team. We just recently, we pre-collect, we make sure that they get the payment before we schedule the visit. Works great in theory, sometimes doesn't always happen. A big team. So starting to notice that we're slipping a little bit there and talking to the front desk about it and asking them and saying, hey, what's going on here? Well, I think it's hard for us to sometimes ask for this. I think it's a lot of money. So then a very obvious thing to me that we need to do some more verbal skills training. But then I got some pushback, well, what's wrong with the way we do it? And I said, there's nothing wrong with the way we do it. I just know we can do it better. And the reason being that we should do it better is because then one, and this is what they often don't see, and we don't often project as practice owners, and this is what I'm talking about at the summit, is that we're talking about a policy for pre-collection. Why does this work so much for practice owners? Well, the people show up when they put some skin in the game before they schedule the appointment. It works out really well for that. But why does it work out for patients? It works out for patients because then we don't have a patient coming in and asking a bunch of questions and trying to set up financing the day of their appointment, or having some misunderstandings that happened. Well, I don't remember having to pay that, 3-4 weeks ago. And then we're going over a treatment plan twice. So now we're doubling the amount of time we're spending on the treatment plan, but now we just put our whole day behind. And that means we're not taking the best care of all of our patients. So it's kind of spinning it back and forth. And this is what I explained to my front desk team. I said, hey, we're doing good. You girls are doing great. But I know we can do better. So to answer your question, what is growth? Finding every area of your practice, every area of your life, try to optimize it to the max, and just realizing that it's always a work in progress and it'll never be done.
And So you're a dentist still. You
Mhm.
had the privilege of selling your practice, and you still work part-time as a dentist, and you're an
Yeah.
author, podcaster, consultant, and coach. What kind of putting your dental cap on and what you were
Mhm.
had to see and what you see of your compadres out there? What are the issues that are facing motivation and what we were talking about? Was it inspiration? Yes, motivation
Yeah.
and inspiration. What Okay, so why is that important to have motivation and inspiration? And what are dentists facing that are sapping that or counter to that, or they're predisposed to diminishing? What are you seeing out there?
Yeah, I think a lot of us will chalk it up to, well, it's a new generation, it's a new culture of people, and they're much more purpose driven, and that's what it's. But I don't necessarily think that's a new thing. I think it's just something that we're kind of honing into is that people want a purpose; they don't just want a job anymore, you know. And the fact of the matter is when we're looking at a dental practice and we want to be doing something that's worthwhile, we want to be changing lives. It's very easy to change somebody's life when they've got, a mouthful of cavities and just it looks like crap and you're fixing it all up and you're giving a great smile. You're changing their life. But it's often we're not like realizing that all that goes into that, and as well as not just those big cases, everything is life changing. Everything that we do is helping a patient be more healthy, is having them optimal dental health, like looking forward and look at studies where people are edentulated. They don't have their teeth. Do they live as long? What's the mortality? Is it there different mortality in people with teeth or without teeth? What are we doing as a team to help the patient live their best life? And it's not just in the hands of the dentist and the assistant and the hygienist. It's every little step along the way, because we've got to get our patients to say yes. If I go to the heart doctor, and they say, hey, you got a clogged artery, you could have a heart attack. I've got, okay, get a procedure done or die. Now we're in dental and we're going to say, hey, you got this issue. It doesn't hurt. You didn't know about it till you saw me. There's no, don't get anything done and die. Like I don't have that working for me, the opposite. And so we have to be intentional about the way we take care of people because we want them to be healthy. And that's what I'll be talking about at the summit, how to get the team engaged in that. And it's just something I think it's just so important for this day and age to have an engaged team that feels like they're making a difference. And I'm not just saying that. I really believe in my heart that they do. Every little thing matters. If you come in my practice and you go number 2 in my bathroom and there's no toilet paper, that's going to be a bad day. You know what I mean? Like so is that patient going to say yes to treatment? I don't know. They might not say no because of that, but that's going to affect their experience of my practice. And who brought that toilet? Who's supposed to stock that thing? It's like it could be as minuscule as that, but what I'm trying to express is that every little thing matters. So how I want to inspire people.
So walk me through there are kind of two issues here I see. Well, two modalities, right? The dentist, owner, leader, potentially leader, whether
Okay.
they know it or not, and then the team itself. So let's focus on the dentist. Then I want to go back to the team because I think you addressed
Yeah.
some of it. So with the dentist, what are so motivation is great. I mean, I don't think it's pretty obvious that when we're motivated and inspired about stuff, we enjoy our lives and people pick up on it. Duh. Okay, so I don't think we
Mhm.
have to spend time explaining the benefit of that. What is, because I always, and I mentioned this the other day talking with our head instructor, Larry Gazzardo, I think even more important than the solution is knowing the issue and being able to feel the issue because that motivates you to change. I'm all about, right,
Yeah.
motivation. I'm all about implementation and getting things done. If you don't, like you said, the patient, they don't see a problem, they don't feel a problem, why are they going to change it? It's not life or death the way they see it. The relationship isn't there. So for the dentist, what is their lack? What is holding them back on being motivated and inspired? I know you love it. You're excited. Well, you're the very
Yeah.
few that has become a great business person and leader in that. Many dentists are not naturally inclined to this. So what you've seen, what is standing in their way? Where are they getting stuck of being able to be free of that?
Yeah, I think a lot of dentists sometimes we lack the motivation because we're frustrated
Oh,
and we feel like we've been doing the same thing over and over again, not getting the results that we want. and it just feels almost hopeless. And I see this with a lot of dentists. It's this like feeling of burnout, this trapped. I'm trapped in my op. I'm trapped in my practice. It's not what I thought it was going to be. It's not meeting my expectations. And they think that the people that have these really well running offices, not that they think they're all perfect and unicorns, but they think there's something special there that they can't do, that there's a leader there that has some level of charisma or leadership skills that can't happen, and that's not for them. They're not worthy of that. And I think ultimately they feel slightly ashamed about it sometimes when they get honest with themselves. But what I would try to stress to any dentist listening, or anyone that just works within a dental practice, is that it's available. It's just it's a mindset, not like just it's not a mindset shift like you just switch it on, but it's a way of approaching everything at the practice that starts to create this structure and starts to create this culture that can eventually get a practice running good, so that that motivation for that stress that you get every day in, day out because of all the chaos and all the disorganization, that goes away. So it is possible for the stress to go away. Now, caveat is it possible to have no stress at the practice? No. There's always going to be problems. We're always going to be reacting to stuff to some extent. But when you get intentional about your systems and the way that you run things and your expectations, you're being way more proactive about what you want, rather than just what most dentists are doing is just reacting to what's happening day by day, spinning their wheels, just things are just hitting them from all over the place. And that's that overwhelm. That's where we get that from. And so my message to dentists would be like, no, it's possible. Like, this is something you can have. And this is like, just like what you teach, with the phone skills and stuff like that, like more new patients, all the things that you and I teach, Alex, is like, these are things that anybody can do. They are not difficult things to do. They are just learning the best practice for doing it, and then making sure you're holding people accountable to do it so that they can see that result. And when they start to see it, then they say, okay, yeah, all right. Because otherwise it's just, otherwise it might feel like you're a corporation telling the practice what to do. This is how we do it. Why? Because we said so. No, that's not going to work. It's got
Well,
to be for the benefit
I
of
think
the team and the patients.
in the green room, I found a little dental smidget still on you. And I think it's common among all people, which is the fear of change and not wanting to
Yeah.
change. We're comfortable.
Yeah.
And I think part of the psychology is dentists are comfortable. And I don't want to just single out dentists. I mean, just more so dentists in general. But all human beings, it's just scary to change.
Yeah.
Part of business training is embracing change. Stephen Covey always said, like, if it ain't broke, right? He says, break it. So you start
Yeah.
to embrace change. You look for change. We say, oh, this is how we do it. I have one office might say like, well, I don't want to do something where you mess up what I already did. What are you so afraid of? And what I would
Mm-hmm.
say is this is what we teach. It's all the same stuff in how do you put it? Philosophy is all the same. You may say it a little differently, but the philosophy is all service based. And so it's going to
Right.
be not sales, but service. And it's going to be things that support that. And you hear it a different way from a different instructor, it opens your eyes. So you never should be afraid of that if you have the philosophy right. But I think change is a big barrier. The fear of change, the fear of the additional stress. Already
Yeah.
they're burdened and now I have to do that. And this is a theme that I keep seeing, which is we're seeing the cost of staff going up because of the economy, but dentist salary is not necessarily going up. Revenue is not necessarily going up, especially those that are beholden to, quite a bit to insurance companies. And what I say is your team may or may not giving you the return that you want, that it's important that you invest in them as an insurance policy to make sure you are getting them up to what they are. It's kind of like a computer. You want your computer to perform better, install better equipment or
Mm-hmm.
software or hardware to make it better. Same with your team. You have what you have. You're paying what you're paying. Put better software in that. Uh, Pour into them with leadership and coaching and things like that, and inspiration as well to be able for them to perform better. They perform
Yeah.
better. And this is the short-sightedness, right? I mean, you see this as a business person, but dental cap is, whoa, that's money. But then business cap is, well, it's only the cost of a veneer or two, And what will it make me later? Business people are always saying, I don't mind making that investment. You're asking me this one marketing thing I do, I'll drop 20 grand in that. That's a lot, but I know what the output is going to be. And that's what entrepreneurs do. And dentists have to start to embrace that this is not stupid money. You do it for a reason, but and then I keep going back to Tony Robbins. What he taught us when I worked for him is model the best. What are they doing? And if you're not doing, then you have something that's holding you back, fear of change, fear of loss, and things like that. But yes, only a baby likes to get changed, the diaper changed, but we have to condition ourselves to start to go towards the discomfort to change. And I think that will help us then to be open to more of that motivation and inspiration, because you're not going to accept it if you're afraid to go into the unknown, if you will.
Well, and I think you also, we've got to approach this change as something that's normal and expected, and not internalize it as this is something we're doing wrong, we're doing bad. It's funny you say the change thing, because I remember when I graduated school, I've been a dentist for 15 years now. And I remember just seeing some old guys work and just being like, how the hell are they still doing it like this? What is their problem? Now, me, fast forward 15 years into my career, everyone's digital printing and doing all this stuff. And people are like, you're not doing that at your office? I'm like, just don't want to learn it. Don't want to learn it. And I told somebody, I said, I'm just too far along in my career to learn that. I just don't want to. And they're like, dude, you're 40. Like, what the heck are you talking about? But that's what it is. I don't want to learn something, because as you know, and maybe the listeners don't, I'm only at my practice doing clinical 6 days a month. So I'm not that clinical anymore to where it would be really exciting for me to do that. Now, talk about like changing up our phone tree, stuff like that, like in digitalizing and automating a patient forms. Yeah, I'm all about that. That's cool. That's still exciting. I'm still running the practice, but my role at the practice is more management and running it, leadership and vision, than it is the clinical stuff. But yeah, I am eating some humble pie for me criticizing that dentist right when I came out of school, because I see how older dentists are still doing things the way they were. Because I'll get a dental rep come in my office and say, hey, you got to check this new stuff out. It's great. I'm like, well, my old stuff's fine. I've been doing it this way for years. It works. I don't want new stuff. I don't want to change. So I feel you.
It's normal. So we always start with the visionary, which is the dentist, whether they like it or not. They are the visionary of the business. So now with the team. And so, again, you're focusing with your presentation on motivation and inspiration for everybody. And with the team, we kind of alluded to that, right? That the pay, and making sure you put that, because you can either accept that you're paying more and not getting as much, or say, you know what, I'm going to embrace that. I'm paying more, so I'll invest more to get more out. Let me just dive right in. This is what is. Reality is what is. It's not, we put our head in the sand or we are Pollyanna. This is what's going on, and what can we do to use it for our benefit. So that's one of the steps there. So you were also talking about purpose, and I think you made a really cool point. I never really heard it that way, because we think that the new generation is out of the blue. They just want purpose. That's just this generation. Yeah. They're the purpose generation. But I think this has been itching along for a while. And it just that's what happens. Things hit a critical mass where you don't see it. And then all of a sudden they appear and they go, oh, where did that come from? That must be the generation. It's been bubbling up where people are like, especially I think with technology and interconnectedness, you're like, I don't have to just do 9 to 5. I want to be an individual. I want purpose. I want to make a difference in the world. I want to have it all. And I think I don't want to settle for just a job. Yeah. And it's interesting because we would never fault a business person like you or a dentist who says, I like to also do coaching, or I like to invest in some innovation or design something, or have a real estate company or do investment. We would never fault that. But if a team member wants to have that entrepreneurial spirit or wants to have something where they have meaning in their life, why wouldn't we, instead of, resenting them, why not pour into that? Why not totally embrace that and ride that horse? Because I'll tell you something cool about our company. All of our people are contractors in the sense that, I always say to them, All-Star is an entrepreneurial alliance, right? Even this Practice Growth Summit, it's an alliance with other speakers and business people to bring their following all together. It's a great event. And same thing as All-Star is I see the people, they're working like 10 o'clock at night. I'm not asking them to do that. They want it. They love what they do. And I'm not saying your practice, they're going to be doing that, but if they took pride, if they felt that there was a movement, a purpose to what you stand for, that's a whole nother level of service. You don't have to like tell them, they want to do it. And that's
Yeah.
where this idea of being surrounded by great individuals like Dr. Paul, right? And others, to see that rubs off on the dentist and the team. And you see other teams and you
Yeah.
know it's possible.
Yeah, and I think that's what I want to talk about at the summit is that I find, and I do this with my coaching clients, is it's not, it's there. It's there in every practice. There is that purpose, but is it articulated well? Is it lead by example? And you mentioned downloading software. Man, I tell you, in every single practice that I've seen, and I'm sure you see the same thing, the front office and the admin team is the least. I mean, they're still running on like old school DOS, man. Like in most offices, like they don't get any new downloads, and we just sit them in front of a phone and say go. And it's unfortunate. And I know from my personal experience of owning a practice for now 12, 13 years, when we have went to courses, even bad courses, I'll even say bad courses that we went to, it was still a team event, and it still jogged discussion.
That's right.
Some discussion of what we were doing, and it got everybody excited about, well, I liked what they said there, but I didn't like what they said there. But what do you guys think? And I think we could try this. Yeah, we could probably do something like that. And it reinvigorates this passion of growth. And it's that growth thing. We're going somewhere. We're doing something. We're evolving. Versus this just maintenance. We're just doing the same thing over and over again, the same way we've always done it. And I like what you said, like business is about growth. It's about change. It's about embracing change. And I've read that before, but just hearing you say that now, it's like that is something that I will be telling my team at our next team meeting. And because I've had a lot of that pushback. Why does everything always have to be changing? And I said, well, look what happened to Kodak and Blockbuster. Like
True.
They didn't change.
You know what I find? Two things that occur to me. One, in doing these podcasts, the listeners are almost on a journey with us. Like we're just having a conversation, sharing ideas.
Yeah.
I mean, every time you and I get together, we're like, oh, I'm so motivated. It's like, and we're kind of like, we're learning from each other and we're sharing this as a podcast. And they're all like, we have like the dentists are in the room. We're all hanging out together, just sharing like what we're seeing type situation. So I think that's pretty cool. And I think that you hit a really cool point, really interesting point, which was, even if the event sucks, I thought we would say that, any event you go to, you're really highlighting a point that just the fact of getting out, I was talking to Larry, our head instructor, about this, just getting out of your practice, going somewhere else with the purpose of learning, even if you ignore everything they say, but you're together. Like in our practice growth summits, I remember in the past, I would see team members having lunch or they would have breakfast, for example, together. And of course, they would then have lunch and meet other people, but it's the stuff after the fact. They're talking to guys like you and the speakers and asking questions, or me or so on. And then we get to talk with them one-on-one. I mean, what's great about this event, which we expect to, we're already on pace to sell out really quickly, is that it's smaller. It's about 100. I don't want to keep it too big, so that you get to spend time with people. So I think you really identified a very important point that yes, the content's important, and that's our job to make sure it's the best. But I say even more important than the content. The content is almost like I say with dentists. Your ticket is just you have to be a great dentist. For our business, we have to provide good content. That's your just ticket to even work. But after that, it's the intangibles. So when you're there, who are you meeting? It's the networking, it's the growth. And then you go back, to what you're saying, you're motivated and inspired. So let me ask you this, because we're on that one question, and I'll have one more after that. One, because you're kind of speaking to that. Why should dentists and team members come to the Practice Growth Summit? Why? Because again, I'm just going to be devil's advocate here. I mean, they have to, okay, look, I have to cut down production time. That costs money. I got to send them their tickets, which are affordable. That still costs money. Then I'm paying them. That costs money. And I'm getting them over there. That costs money. I mean, we do have payment plans, but why am I going to put that money into it? I'm already stressed as it is and whatever, and I want to change. Why do that?
I think the returns that you're going to get on investment are not always going to be in the numbers. There are going to be returns in the numbers, but it's going to be in the morale. It's going to be on your team members posting on Facebook, Instagram. Look where I'm at. Hey, your boss sent you to that. That's great. But I think what the major value you get is that it just fosters this culture of never ending improvement, where we're constantly coaching each other. We're constantly working on our craft, seeing what we can do. And, if you're looking at the cost and wondering if you can afford it, I can tell you from experience. I mean, I'm here in the Midwest. I'm in Chicago. We had a crazy cold and a crazy snow and then rain and snow and rain. And when it snows and then it rains, it gets really slushy. And then when it turns back into snow, it gets really icy. And we shut down our practice last month for 2 days, not 2 days in a row, but I can tell you not a single thing changed with numbers. We did exactly what we were on track to do. And we did because shutting down your practice is a necessary activity for practice owners. And I'm talking about shutting them down for meetings. I'm talking shutting them down to take people to events. You think you're losing out on a day of production, and you think that you're looking at that opportunity cost. Well, if we were open, we would have made this much. You're still going to make it. It's going to shift over to other days. I'll even tell anybody, take me out on just take a chance and just take off at least one full week, if not 2 weeks in September, and see if next September is the same as the previous September. I promise you it will be almost identical, because that is the September we always have. The things will shift into others' days. Now, I guess if you're super packed and every day is full and you never, ever have a hole and you maybe shut down a day, hypothetically, theoretically, it could affect. But even if it did cost you some money, you're going to get a return on it.
Yeah,
You're going to get it in the attitude of your team. You're going to get it in creating this culture of the aligned culture. Let's do things better, and let's have fun together and get to know each other outside of practice. I mean,
it's true.
I do this with every single coaching client. I say, hey, you guys do like social events? Sometimes. Set up 2 in the next 4 months. Just set them up. Do it after work or do it on a Saturday. And they do it, and every single one will say the same thing. Wow, I never thought that would be so valuable to do it. And it's just something about spending time together. People that like each other like to work together. And I think it's such a critical part. And it always reminds me of I can't remember what book it was, but this part stuck with me, is that people will stay at a job that they hate because they like the people they work with. And I'm not saying that's the goal we're shooting for. We're not shooting for that, but I think that speaks to some level of work satisfaction coming from enjoying the people you work with. And to enjoy the people you work with, you've got to spend some time together. And the front doesn't always hang out with the hygienist in the back and the assistants. Like, we're all in our little pods often in offices. So get out and do fun stuff. And while you're out doing fun stuff, you might as well learn something and spark some conversation and some dialogue about how you can be a better practice.
Yeah, I just love what you said earlier. I just never, looked at it that way, of how simplicity. You're like, even if you go to an event and it ain't, and the content ain't for you, which you should always go into an event with the intention that the content's there. But more than the content is the experiences you have. So I'll put it that way. You go to an event where you like the content, you like the people, but you're saying to me, essentially, another way of saying it is even more important than that, because that's kind of like the environment, right? Like, wow, I'm with great speakers. I made a good investment. That's a logical brain. And you'll learn stuff, but it's the intangibles. It's the stuff that you weren't intending that you get. And you even said something too, like they're posting on social media. How do you know that they don't post on social media? Well, the friends of the family go, wow, what an great office. I may want to go there for my dentistry, because we're always looking for new content to share on social media, and nobody wants to see dentures and pictures of veneers on there. And before, it's like, I get it. You're so good. But they go, oh, wow, what a good place to be. And that's the idea. We're looking for All-Star to be a place for other All-Star to be. It's a place, it's not about me or you, it's a community. And then we want to take that into our practice, make it the same thing. It's a place that everybody wants to be. It's not a dental practice, it's a community. And oh my goodness, you may look forward once in a while to go see your dentist. My wife loves seeing her hygienist, and so she goes. So that's the idea, and that's what we want to create as a movement. And that goes back to what you're saying, motivation and inspiration. How do we supercharge that? How do we improve that? And that's what you're going to be talking about at the Practice Growth Summit. So come see
Absolutely.
Dr. Paul Etchison over at the Practice Growth Summit, and I'll put a link to that as well. And also, we just released a book, Paul. It's a Practice Growth ebook, and I'll put a link as well to that as well. So for those that are coming and want a little teaser, that's going to be there. Or those who would, the times just don't work, so be it. We're going to have nuggets of wisdom. So we have a little quote from you and all the speakers. So it can be, every year we're saying what's new on Practice Growth. That's what the event's about. The book kind of gives you some highlights of the speakers and what we're talking about. So always something for everyone. I'll put those links in the show notes. I want to thank everybody for being on the program or being here and listening.
Yeah, I'm going to interrupt you for 1 second on your outro, Alex. I want to say one more thing.
Yes.
What is that? I will say that I go to a seminar every year. I haven't went in 2 years, but I went very many times. And I go, and I probably only go to maybe 3 hours of the actual seminar, but I go because of the people going, and I go because of the networking. So at the very least, that's me saying to you is we're going to have a good time. You're going to meet people and you're going to have some good conversations, and the content is going to be great, but we're going to have a fun time afterward as well.
And like I said, I think I'm glad you spoke to that, because I think too much on this kind of promoting events. It's like, here's what you're going to learn, which is important, but look at these badass people you get to hang out with. I mean, Paul was a musician, with an album coming out, and rockstar dentist. I mean, it's pretty cool to share that and all the experiences. So yes, thank you for interrupting my outro. May I continue?
Go.
No, but I'm glad you did. You're a good podcast. You knew it was about to close.
I wanted to get that in there.
Yes, you did. Yes, you did.
All right. Take us home.
Take us home.
Alex.
So you have the URLs for the ebook. You have the URLs for the event. All this other stuff, liking and commenting. We'll keep providing you some great content. Thank you, Dr. Paul Etchison, for being on the program, Dental Practice Heroes. And until next time, everyone, go out there and be an all-star.
We hope you enjoyed this episode of Dental All-Stars. Visit us online at allstardentalacademy.com.